All right. So we are actually going to be covering our Module 1 legalities and conduct for phlebotomy. So within our Module 1 in the Google Classroom, it looks like we have our Module 1 lecture video. We have some information around our biohazard, OSHA cleaning standards, study guides, our cleaning procedure study guides, protecting yourself when handling contaminated sharps, blood pathogen exposure incidents. We have the slides for this lecture, the Quizlets for the legalities and conduct, and then our actual Module 1 quiz, which I guess I should have had that zoomed in for you. I apologize. All right. So we're going to jump right into I'm going to zoom this in a little more. That way, when I switch back and forth, it's there. Okay. We're going to jump right in. Legalities and conduct in phlebotomy. This is really important for you as a phlebotomist or a growing phlebotomist. This is how you're handling yourself professionally in the medical field. It's knowing what the high standards are and knowing how to hold yourself to those standards. You must always conduct yourself in a professional manner, and remembering that your core concern is always the patient and the standard of care that they're receiving. So in this module, we are going to cover all of those things, or at least brief on them. Phlebotomy ethics, informed consent, standard of care, patient bill of rights, malpractice, negligence, HIPAA, and how to maintain professional conduct. Phlebotomy ethics. So anytime ethics are involved in healthcare, it's really important to know what this means. So ethics are used in almost every career field, not just healthcare, but it's super important for you in healthcare to be aware of what these things are. Lawyers, businessmen, doctors, and now you as a phlebotomist or a new phlebotomist will need to know what these code of ethics are. Holding yourself to values and principles higher than your own values and principles. You may learn something coming into this class about ethics or how you're holding yourself to a higher standard now than when you first started. Integrity and living by a code of ethics. You always want to hold yourself to a high degree of personal and professional integrity. Patients are nosy, and if you see the same patients all the time, it's very likely that they may be scoping you out on social media, and you want to make sure that either your profiles are private or they're not able to see some of the things if you may have questionable jokes or pictures or things like that online. Core concepts of medical ethics. So informed consent and standard of care. We're going to cover some of those in a little more detail. Some examples of professionalism in phlebotomy is dedication to high standards and precautions, respecting the patient's dignity, privacy, confidentiality, and the right to know. Integrity, appearance, and hygiene for yourself, introduction, communication, and listening. On to informed consent. Your patient must agree to the procedure that you're about to be formed, and they must know what you're going to be doing. Talk to them through it. As you're doing different steps, you can talk to them. So different types of informed consent are written or formal consent. Your patient reading and signing statements that describe the procedure that you're going to be doing. Non-verbal. This is your patient holding their arm out after you introduce yourself and request their permission to perform the procedure, or even a nod. Verbal consent. The patient is verbally telling you that they give you permission to perform this. Every patient, every time for consent. You must ask every single one. The patient's agreement to the procedure you're about to perform, okay, every time. Ask them if it's okay if we do this venipuncture, or am I okay to draw your blood? Or, which arm would you prefer me to use today? Them telling you which arm or holding their arm out is getting that consent and them giving you permission. So during your consent process, it is important to introduce yourself identify your patient, explain what you're there to do, and then ask them for that consent. Regardless of if the patient agrees to a procedure, okay, there is an underlying and legally binding basis of consent given. The phlebotomist must have the skill and knowledge to perform that procedure, okay? Even if the person forgives or gives consent for a phlebotomist to perform a procedure that they have not been trained for, it is not acceptable. If you were not trained, do not do it under any circumstances, okay? In this class, you will be given the skills to perform venipunctures, finger sticks, urine testing, and all sorts of other different things. But if it's something you have not learned, it is not in your scope of knowledge or skills, don't do it. Someone else on the job can train you how to do it, but unless you are trained, do not do it. The patient's Bill of Rights and medical standard of care is important to your patient's safety, okay? So the American Hospital Association in 1976 wrote the Bill of Rights and what is defined as the standard of care for any individual institution. Now, every facility is going to have their own set of patient Bill of Rights and their own standard of care written, but it all kind of includes the same information, okay? The standard of care is going to outline the conduct that you or a phlebotomist in the same field will abide by to ensure that any instance of malpractice will not occur. It is used to combat malpractice and ensure highest level of patient care and also safety. The Bill of Rights and the standard of care is put in place for your patient's safety. By the way, if you hear little noises in the background, it's because I'm literally doing hand movements and clapping or whatever while I'm doing these videos. So patient's Bill of Rights and medical standard of care continued. So employment policy manuals will give you the exact definition for standard of care and patient Bill of Rights, but just remember that standard of care is still measured up to other phlebotomists in your field. And reading the policy. If you're hired on somewhere, make sure you know. Familiarize yourself with that employer's policies. Patient Bill of Rights, key points that will be included in every facility's Bill of Rights, patient's Bill of Rights. Fair treatment and respect for care. Obtain their medical records and include all notes, diagnoses, and test results. Give consent to any and all medical treatments except in emergency situations. To refuse treatment, prompt care based on urgency of their care. So these are all the patient's rights. The patient themselves has the right to these 5 things, and it will be outlined in every patient Bill of Rights, or it should be. Negligence. So direct harm and indirect harm is kind of iffy. It's just subcategories of negligence, okay? So some of your questions on exam and stuff you might come up to might get a little hairy. But just remember, negligence is like the big umbrella category, and then direct harm and indirect harm fall under that. So negligence includes harm caused by poor disposal of equipment. So if you do not throw away or put your sharps into the right receptacle, you leave it out on the desk and somebody gets hurt, that's your fault. Okay, that's a form of negligence. Now, indirect harm could be something that's not directly affecting someone else, which we're going to talk about direct harm. Sorry, I'm kind of jumping. So indirect harm could be mislabeling, misidentification, or even selecting the wrong tube for a test. While direct harm is something that is directly hurting someone, okay, or damaging a person. So it can include damage done during a venipuncture or resulting in nosocomial infections from improper technique. A nosocomial infection is a infection that the patient got while in a facility or hospital. They didn't come in with that infection. They got it while they were there. Okay. Following an institution standard of care and leaning heavily on your training will avoid the possibility of negligence in the field. So listen to that again. Following the standard of care and leaning heavily on the training you received will avoid negligent situations, you harming a patient in some way. So for a little more indirect and direct harm situations. Indirect harm, an act that was not directly done to someone, but it did eventually lead to an injury. So I laid down an uncovered needle in my work area. I did not dispose of it properly. My next patient came in to get their blood drawn, and they laid their hand on the uncovered needle, causing injury to their hand. Direct harm is an act that directly causes injury or harm to a person you're working with. So I decided not to wash my hands before working with this patient while they were admitted in the hospital, and that patient ended up getting an infection as a result, and they had major complications and ended up having to stay in the hospital longer. So my decision to not wash my hands directly impacted my patient I was dealing with. All right, so malpractice and negligence. So these are two different things, but they're not at the same time. They're kind of the same category. They're the same thing, but the way it is determined if it's malpractice or negligence is what separates them. We're going to go over a bunch of things. I'm going to explain that in a little more depth, okay? Any level of care that deviates from your institution's standard of care that causes harm to a patient is considered malpractice or negligence, okay? So if you are not properly trained on how to perform a procedure and you chose to do it anyway, the resulting damage can be considered malpractice. Unintended damage caused by venipuncture could also be classified as malpractice. Damage beyond the expected is considered malpractice. Hitting a nerve, hitting an artery, extensive tissue damage. Okay. Negligence, on the other hand, is an act of carelessness that results in injury that can be deemed by a normal person. So the first two that I went over, malpractice situations, another phlebotomist would be able to say, hey, you know what? You not doing that right caused this person's injury. While negligence, anybody looking at the situation, doesn't have to be a phlebotomist, can actually say, hey, you were just careless and didn't think, and that's what caused this injury. In other words, if a phlebotomist had the training to conduct the procedure based on an institution's standard of care, but chose not to, that is negligence. So it doesn't take somebody trained in phlebotomy to know that this person just didn't follow the standard of care. It's written, it's there, clear as day for them to follow that process. All right, so here we are on a little closer look on malpractice and negligence, because this is a huge, confusing, jumbled mess for a lot of people. They're like, I still don't understand what the difference here is. So the concept of malpractice and negligence are the same. I had mentioned that before. So the actual basis of what it is the same. It's how it's proved, or who can say this was done wrong, that determines if it's negligence or malpractice. Negligence. What would a reasonable, normal person do? Okay. So sounds a little confusing still. What do you mean by a normal, reasonable person? So everyday Joe, okay, can look at the situation as a reasonable person and know that they did not follow ordinary care processes, steps, or do it right. Failure to use ordinary care, failure to take the necessary steps that a reasonable, normal human being would take, doing something or not doing something that a reasonable person would do. A normal, reasonable person would clean up a spill in the workplace if they see it. This is a normal, reasonable option or reaction. You know, you see a spill, you clean it up. You don't want somebody to slip and fall, or it just looks bad. Whatever your reason behind it, a normal person would clean up that spill. An unreasonable, non-normal person would walk around and leave it. If someone was injured from falling on this spill that was left on the floor because the unreasonable person walked away from it, the unreasonable person did perform a negligent act. So me walking in to my work and going, oh, look, there's water on the floor. I walked right past it because I'm going to go clock in regardless of stopping to clean it up. I don't know if clocking in actually changes it because you're on the clock or not. I don't know, but whatever. So I have something I want to go do first before I clean up this mess. So I'm going to leave it there. Well, in the time that I left it on the floor, somebody came and slipped and fell and hurt themselves. I am then responsible because I walked away from it. I saw it and I did nothing. A normal person can say, hey, you walked away from that spill. You knew it was there. You saw it. You should have cleaned it up. It doesn't take somebody with special training to know that I did something wrong. Average jurors can make that decision. That is negligence. Okay. Now, for malpractice, this is where the difference is. So pay special attention to this. Malpractice means that a professional, reasonable professional in the same profession, doing the same job, would they make the same decision under similar circumstances than what you did? So a phlebotomist would need to look at whatever you did, okay, in that situation. Okay, did you palpate? You hit an artery, or you stuck a tendon or a major nerve causing permanent damage. Did you actually select a proper site? Did you go on the underside of the wrist here near the patient palm that you're not supposed to draw in because it was an easy vein? As a phlebotomist, you know you're not supposed to draw blood there. A normal phlebotomist in the same profession would know you don't draw blood there. So they are the expert testimony. They know the standard of care, and they would not have done it. That means it's malpractice. The average person or average juror wouldn't know the difference. So let me go a little more into that one. So cardiac surgeon. So one cardiac surgeon said, yeah, we're going to do XYZ procedure on this person. They do it, and it causes that person to have major complications or issues. The second cardiac surgeon that is now performing expert testimony says, no, that was not the right steps. This person had underlying conditions. This was not the right standard of care. They never should have done this procedure in this manner. That is malpractice. Expert testimony is required, or somebody in the same profession, to decide if that was the proper steps. Negligence, an average person. Okay. All right. HIPAA. So Health Insurance, Portability and Accountability Act. So with HIPAA, pretty much don't talk about your patients. Honestly, your patient's personal and protected health information can include lots of different stuff. All right. So their address, insurance information, diagnoses, place of employment, date of birth, social security number, privacy agreement. It is our duty in healthcare to protect our patients' PHI. Okay. We shouldn't be sharing information about our patients. We should not be going and saying, oh, guess who's a patient of mine now? That's wrong. Nobody needs to know that. Me and a physician that I used to work with for 9 years, we're really good friends. She still works within the company. I don't. It is illegal and it violates HIPAA for her to call me and say, hey, such and such died, or such and such changed doctors, or whatever the gossip might be. Her even speaking to me about anything to do with that person, even if I know who they are, I am no longer involved in their care. They should not be talking to me about it. Privacy agreements. So when you first start working at an institution or facility, there is going to be paperwork somewhere that says that you agree to hold this information, patients, PHI, coworkers, all that stuff, private and not share it. Okay. Remember, your duty is to protect a patient's personal health information, their PHI. All right. You can be fired. You can be fined, and you can get in trouble for sharing that information. Professional conduct. So professional in appearance. Make sure that you're following your employer's dress code. Wear your scrubs, abide by code of cleanliness, pay attention to your self-image, hygiene, and stay sanitary. One of the worst things as a manager that I have had to experience is discussing somebody's odor with them because they smelled bad. It was bad. I could not walk into a room after them without smelling them, which means when they are closed in a room with a patient with the door shut, that patient can smell it. Okay. Don't do that. Some other guidelines, making sure that long hair is not impeding your vision. Your hair should not be touching their arm while you're trying to draw blood. Long nails can inhibit you from performing your procedure properly. It can affect how you're holding things or how you're navigating. It could affect your gloves fitting properly. It can also have bacteria growth underneath the nails, which could cause infections at the procedure site. Long jewelry, lots of jewelry. It's frowned upon because it might impede the quality of your work. It can get in the way. You may touch them, stuff like that. So you want to be cautious of how much jewelry you're wearing. Also, jewelry in some settings and some facilities can actually cause issues for you and your patient. Dementia patients have a tendency to reach out and grab stuff. If somebody's falling, they have a tendency to grab whatever's closest to them. They may end up ripping your earrings out or ripping your necklaces off and causing you harm because of that. So maintaining professionalism, be timely, try not to be late, be a team player, assist where you can, be cordial, respect your peers, be organized. Make sure you keep really good records. The more documentation you can do, the better. If it's not documented, it didn't happen. Expand your knowledge, skills, and this will continue to keep you as an asset for your organization. I need to start over with that one. Expand your knowledge and skills so you are an asset to your organization. And I don't know why I didn't put this one as number 1, but it should be. Lead with kindness. Understand a sense of empathy, sympathy, or compassion, whatever you want to call it, but just lead with kindness. A lot of times patients are not feeling well. Sometimes they're just in a bad situation and they're going to be grumpy. And that's okay. Just make sure that you are leading with kindness regardless of that situation. All right. So you have some key terms here for Module 1. The Quizlet flashcards are available in your Google Classroom down here. Quizlet flashcards for Module 1. If you have any questions, let me know. But we'll move on to Module 2. I'm doing re-recordings of everything for the 2023 year. And hopefully these are good enough to continue using from here on out. So let me know your feedback if you have issues with videos or need clarification on anything, because I grow with you and our videos will change based on your needs. All right, guys, let me know if you need anything else. Have a great day.